Okay. Hi, Mary-Beth. It's so nice to see you. Thank you
Good
so
to
much
see you
for
too,
being here. Thank you. Thank you for taking the time to talk with us. I know you're really have a full schedule and a full life, so this is wonderful to have you. So I know that FA has been a part of your life for a really long time, and I'm wondering if you would like to share some of your FA story with us to start.
Yeah, absolutely. So I'm Mary Beth. I'm 28 now, but I was diagnosed when I was 1.5, because my older brother, Danny, was diagnosed with leukemia and consequently with FA. So after they kind of narrowed down on the diagnosis, they went ahead and tested me as well because it was genetic. We both were FANK A, and he immediately kind of went into treatment. About 2 years later, we went up to Cincinnati where he had 2 failed bone marrow transplants and unfortunately passed away from an infection in the ICU ward following the second transplant. So my story is completely entwined with his in terms of if it wasn't for him, I probably would have gone undetected well into adulthood. Um, my my experience, even though we were both FANK A, is completely different. I've had a relatively healthy experience with FA. Maybe one instance in high school where my numbers, my platelets and CBC kind of started to tank a little bit, but thankfully it kind of plateaued and started rising again. So I've not gone into bone marrow failure. I haven't had a transplant. I haven't had a cancer diagnosis yet, knock on wood. So I think the biggest part of my life with FA is making sure that I manage my care really well. So that looks like mental health and making sure that I'm keeping up with counselors and any anxiety that I'm experiencing when it comes to just like being hyper aware of your body and any changes that happen. So anything going on in my throat, any changes in my eating habits, any sleeping issues, those are all things that I pay a lot of attention to. And if I ping something for longer than 2 weeks, the anxiety kind of starts to settle in a little bit. And I would say that transitioning from pediatric care to adult care, where I moved 3,000 miles away from my family after I got married after college, and having the experience of transferring my care from my mom knowing everything about my health to me being in charge of my health was really terrifying. But it also put me on a good course to like find all the different specialists and providers that I need, and gave me the tools to assemble a care team that I really trust, that's listens to me really well, lets me self-advocate. And that manages my care so that we don't have any gaps within treatment or monitoring protocols. So yeah, right now, just really in that waiting game of knowing that if cancer happens, that it's not an if, it's a when. Like cancer is going to be a part of my story at one point, and we're just trying to do everything that we can so that I can stay ahead of that, and hopefully catch things early so that we can move into positive treatment outcomes.
Yeah, well, I'm so happy you've been healthy and well, and I know there's been little bumps in the roads, and I think your narrative about the self-care and the transition to adult care is a whole nother important conversation that we will be having in the future. So thank you for that.
Yeah.
I know you're a huge advocate for yourself and for others, so thank you. So I know that FA is a big part of your life, but I know that you have a really full life outside of FA. And so
Yeah.
we'd love to hear some of the things that are important to you in life, where you get your joy, your purpose outside of FA.
Yeah, absolutely. So yeah, I would say that while my entire life experience is with FA, and there's like nothing I would do to remove FA because it's really kind of taught me to live in a different way. My husband, like I said a little bit earlier, my husband and I moved from Georgia to Oregon right after college and just spent 5 really incredible years going backpacking and hiking and snowshoeing and cross country skiing, and really just kind of chasing adventure and enjoying the life that we got to build together over our time there. In the last year and a half, we've moved to Chicago, and it's kind of this same, moving cross country is not easy, but we do feel pretty, we're like pros now. We're really good at packing. We're really good at getting rid of things. We're really good at moving, and building a community for ourselves that keeps us really rooted to the kinds of people in the communities that we want to engage with and work with. So I would say that joy for me comes from loving other people really well. For me, that manifests itself most prominently through cooking. I'm a private chef, and I love to cook any and every kind of food. I'm almost always reading through 2 or 3 different cookbooks at a time, trying to understand cuisines a little bit better and educate myself about different cultures and what their eating histories are. And then, you know, like I would like to cook for people, which is hard during COVID because I can't have anybody over. So we have tons of food at the house all the time right now. And I'm like airdropping like food to people throughout the week. Or like I learned how to make sourdough bread during the pandemic, and so I've had a couple of friends come and I kind of just toss it to them from in the parking lot. So yeah, I think like joy and purpose for me comes from loving other people well, being really rooted to my communities. I am first generation Guatemalan American, and so being a part of immigrant communities, being a part of Black and Brown communities, and following the leadership of really diverse groups of people, so that I don't have to be the loudest voice in the room, but I'm learning from people who historically have not been given voices. Like that is, that's really important to me and to Ben, is cultivating a community like that, where we're not so like focused inwardly and on our own lives and our own struggles, that we're like eyes closed to what's going on around us. We really like to be rooted in that way. And yeah, I do my best to kind of live out purpose through food as activism and love for others, and also for myself. Like, you know, food is one of the most powerful ways that I can connect with myself when I'm in like a grief spiral, right? To cook for myself is one of the only tangible ways to really give my body like an I love you, right? So yeah, I mean, we're looking forward hopefully to a long life of being able to do those things together.
Wonderful. And I know that is a huge part of your life, and I'm thankful that I've been the recipient of some of your loving cooking, and it's delicious. And so where does family fit in there into your life?
Family is really important for us. It's been interesting, you know, living cross country, right? Removed from immediate family for sure. But Ben and I started dreaming 4 years ago this week. It's the first week of September, of having kids. We, you know, we're sitting around a campfire, and Ben said, like, you know, I'd really love to have like kids around the campfire and to go camping with them. And I felt this like sigh of relief, because I had kind of been thinking about the same thing, but we'd only been married for a little over 2 years at that point, and we had always said 5. And so I was really thankful that he brought that up. We've always kind of dreamed of being, you know, we're those family members that live really far away, but when we come home, we like, you know, we're on the carpet playing with the kids, and I'm in the kitchen cooking 30 different entrees for, you know, his family and my family. So it ends up being like gatherings of like close to 100 people. And we always knew that we wanted to have, you know, kids that we could invite into that, that we could choose to be like really independent and, you know, adventurous, kind of like us, but also to have this kind of rooted connection to where they're from and who they're from, in the larger family experience.
Right. I have no doubt that you will accomplish that. So when did your journey with fertility start?
So it started in September of 2016. So basically, Ben and I have this conversation. We go on a 14-mile hike the next day, and then I come home and I call my oncologist, my oncology hematology team, and I say, hey, listen, we're thinking about, starting a family, and I know that we can't just jump into that. So like, I know that there are things we need to know about where my body is at right now, what my blood counts look like, and to know what the safest way going forward is, for us to pursue this. So my doctor talked to a MFM specialist, a reproductive endocrinologist, basically like a high risk team at the hospital that I had all my care at. They talked to my GI specialist, they talked to my ENT, so basically within a week I was at OHSU in a conference room with about 12 doctors, basically asking them for permission to get pregnant. If that's not your experience, then I don't recommend it. It's exactly as unromantic as it seems. But
how
so
important, how important to have a huge team like that, a comprehensive team to help you through this.
Absolutely. And I always knew that that was going to be a part of my story in any kind of pregnancy, that I was going to need specialized care or attention. And there's not a whole lot that we know about pregnancy in women with FA. Unfortunately, I think when we started thinking about it, I think there were 33 documented pregnancies. We had kind of no idea what to expect, but always knew that I needed to have a really good care team that was really upfront and kind of all talking to each other throughout that process. So once, we did a few rounds of, testing, checking in everywhere to make sure, my throat and my mouth were clear, and my blood counts looked good and stable. We got the green light to go ahead and start trying, and we did, and we kept trying, and it became pretty apparent around 6 months. In the regular fertility world, they tell you to try for a year if you're under 30, and then go seek out specialized care. And then if you're over 30, to try 6 months. I called my doctor at 5 months and I said, hey, listen, I think my experience is closer to that of a 30-year-old than that of a 25, 22, 23-year-old. And so I want to come in to do some testing. And thankfully, the way that I assembled my team is that they believe me, and if they don't believe me, I fire them. And so she ordered a round of just like baseline hormone tests for me. And we didn't really get a whole lot of answers because all my numbers looked pretty much okay at that point. So we did a few rounds of just the easiest hormone therapy that you can do, which is Clomid or Femara, to stimulate your ovaries to hopefully produce nice ripe eggs that you can use with timed intercourse, and hopefully that works. It's like the first kind of step into the fertility world when you're going to start doing any kind of targeted treatment. We did 2 or 3 months that way, and nothing worked. So by this point, we'd probably been trying for over a year. And we knew we couldn't afford realistically to go into a round of IVF. To get in the door just for initial testing, for me in Oregon was $10,000 before any kind of medication or treatment protocol. And so we're, young professionals in our early 20s, and that just wasn't an option for us. So we decided we're just going to keep running at this wall of infertility, hoping that, with enough times, we'll just break it down and eventually something will happen. And it was a pretty miserable 2 years after that of just, we're also, in our mid 20s, and so a lot of our friends are starting to build their families. So at this point in our experience, we've watched some of our best friends have 2 or 3 kids while we're just trying to have 1. So that was really challenging. About the time we hit a little over 2.5 years. Ben, out of the blue, decides, you know what, I'm going to apply to a job in Chicago. Didn't tell me, but then he got an interview, and then he told me. And after, telling me, I was like, well, you know what? Illinois is a mandate state. There's 11 states in the United States that where employers within the state that have a larger, more than a certain amount of employees have to provide fertility coverage as part of their insurance. And so I was like, listen, if I look at their healthcare plan and it looks great, then you can take me wherever you want. Like, I'll go anywhere at this point. And it really was a godsend for us, because, we got the plan and it covers 4 IVF cycles per year and unlimited IUIs. And all medication is covered. So it was like this big open door in just like a 2.5, almost 3 years of just exhaustion and knowing that we needed more, but not knowing how we were going to get there. So we moved to Chicago. I had actually been recommended to this clinic by an FA parent, because there have been several FA families that have gone there to do HLA matching, to do IVF to get an HLA match for their FA child. And when it was recommended to me, I was like, there's no way on earth we can afford to go from Oregon to Chicago and pay for, like, this was 6 months before any of this was even on our radar. And then I made the appointment, and it clicked in my head that this was the same clinic that we had been referred to. So we were actually testing while this family was doing their IVF cycle and their transfer. And so we got to kind of see each other a few times during their stay in Chicago. They were from California. And so we, did the initial rounds of testing. We did 3 full IUIs. We had scheduled 4, but one of them, I just wasn't responding to the medication at all, so it was canceled. And then last September, around the time of the adult meeting, I was stimming for our first IVF cycle. So I did, all the medication, and it was really frustrating because I wasn't responding really well. So by day 8 or 9 of stimming, of putting, 700 times the amount of hormones in my body than is normal, we only had maybe 2 or 3 follicles that were growing that were big enough to develop into eggs. And so my doctors put me on the highest doses of all the medications. And I did actually almost double that number. But by the time I went in for egg retrieval, they only got 4 eggs. And the minute the nurse told me when I woke up, I started crying, because I knew that you lose 75% from the egg retrieval to fertilization. And so I knew the numbers weren't good enough for us to have a really great outcome. So we, every day you get your messages from embryologists, and the first, they retrieve 4 eggs, 3 of them fertilized or mature enough to fertilize, but 2 of them stopped growing almost immediately. And then we had 1 that kept growing, but was growing really slowly. Like, in the world of embryo creation, usually by day 5, you reach the blastocyst stage, and that's when an embryo can be transferred or tested, which we had opted in to do genetic testing. And ours, hit day 5 and could not get to that point. Hit day 6, was still struggling. Finally, on day 7, we get a call that said, we tested it, it's frozen. And a few weeks later, we got the genetic testing results that said that it was a normal embryo. So we were hoping to transfer in November, but then, my cycle was delayed because I had been on all of these medications. And then by the time we could have started a cycle, it was around the holidays. And I was like, I physically cannot be away from family this year. We had just moved. We were in those awkward stages of making friends, but not good enough that we would spend the holidays with them. And I was exhausted physically and emotionally from, a year of being on hormone therapy and, and just feeling really lonely in that experience. So we went to Georgia, and the next cycle we did an ERA cycle where they test your uterine lining to make sure that it's receptive. So, and I was really glad that we did it. It was so painful. It was like, the shots for IVF don't bother me at all. Like, I'm a pro at needles. They don't bother me. I, didn't feel terrible on them other than like hot flashes. But let me tell you that having a biopsy done of your uterus is not cute. Like, but we did that, and we found out that I needed a day and a half more of progesterone when we did transfer. So we planned on transferring in March, and then COVID happened.
Oh, gosh.
So we had to cancel our cycle. And we spent about once we decided to cancel, we decided to go from the city to be in Georgia for a few months, because our families live out in the country, and so we could be outside and have a little bit more freedom. So we came here immediately. When we get back, we 2 or 3 days later, I'm in the fertility clinic again, to start preparing for our transfer cycle. So that was this summer, this July. On July 23rd, we transferred our embryo, and on August 3rd, we found out that it didn't work. And I can't describe how devastating that is, but so right now we're kind of in this in-between space. I'm like, at this point, we're preparing for another IVF cycle later this month. And so for the past, month and a half, I've been juicing, and I'm going to acupuncture. I'm like, okay, I've done everything that I physically can, so it can't hurt to drink an entire bunch of kale, like in the mornings every day.
Or anything.
Yeah. Oh yeah. I grew up with my mom pretty much making me eat and drink a lot of vegetables and taking a lot of supplements. And so my acupuncturist was like, you might be uncomfortable, but I think you should start taking these, supplements and vitamins. And I was like, listen, I was like swallowing 12 capsules of vitamins because my mom didn't believe in multivitamins. They had to be the individuals since I was like 4. So I'm like, so that's kind of where we're at right now.
Okay. Well, I know it's been a tough journey. I know there's been lots of ups and downs, and thank you so much for sharing it, Mary-Beth. And with all that, because you've had so much experience with it, what would you say are the shortcomings or the unmet needs for the FA community? Because fertility care is complex for somebody without FA, and then you add the FA. So what do you see as the needs that aren't quite being met, both emotionally, psychosocially, physically, medically, for the FA community?
I would say, like, there really isn't any kind of level of information or support at this point other than peer support. At the adult meeting, my first meeting was in 2016, which was when we started dreaming of having kids. And the first meetings I sat in with Nancy, like, people just kept talking about fertility. And that first year, to me, because I was sure I was going to get pregnant in like 2 seconds. And so I was bored out of my mind sitting in the meetings, and because fertility comes up in all of these psychosocial settings. After that first year, it was my zip code, right? And fertility was my home base. And so I leaned into that a lot more, and that support was good, but it's, 2 days spread over like 2 or 3 conversations out of the whole year. And there's probably 15 or 20 people that are kind of leading the conversation and who are in the trenches of this kind of care or idea. Yeah. So like emotionally, it's just, it's that one time of the year. I think personally, I've been contacted by at least 8 women within the United States and abroad, in Belgium, in Latin America, in the UK, in Ohio, who are walking through infertility, and they usually find me by hashtags on social media because I'm an open book. And so they're walking this same experience, and they don't know, like, there's no information on what like IVF looks like for us, right? Is it even safe for us to pursue this? So right now, our conversations with specialists is that, we're probably not going to do more than 3 stim cycles. And if we don't have any viable eggs by the end of that, then that probably needs to be the end of my IVF journey, because we don't want to pump all these hormones into my body over long extended periods of time, because we don't know what that looks like in the end. And if we do manage to have a live birth, we'll end up, doing a total hysterectomy immediately afterwards to hopefully think about one less kind of cancer, especially thinking about several years of targeted hormone treatment for those organs. So there's just like, I knew of one other person with FA who had done IVF. And so I sent her a message, and I, started asking her questions about her experience. And she had a very similar experience where she had very low egg quality and very low amounts of eggs. And she actually went on to conceive naturally. But she, when I reached out to her, she was like, I'm going to talk to my fertility doctor, and I'll send you my medical records so that you can see what treatment protocols they did with me and what worked and what didn't. So as far as support goes, it's really peer-led. It doesn't seem like in 4 years of going to meetings, I've never heard a researcher or a doctor within the FA community say, we're really interested in fertility, or in conversations about fertility preservation, right? So, and even less for men.
Absolutely. It's definitely a conversation that needs to start happening. And I think where we're seeing the pendulum swing is that now that adults are living, or children are living into adulthood, and being able to consider this as an option, now we're going to start needing and wanting to learn more about it. So thank you. This starts the conversation, which is exactly what we're trying to do, which leads into the last question, and that is, what would you like the researchers and clinicians working with FA to understand and to hear and to know about fertility care? What would you like them to focus on? How can they best serve this community?
Yeah, I would say it starts with how we talk about fertility and when we talk about fertility. In hindsight, like, I wish this had been a conversation that people were having with me when I was in high school, right? So that maybe I could have done egg harvesting while I was probably fertile, or most fertile, because our bodies age so differently, when I was younger, so that I would have more options as I got older. But I think, as you were saying, so much of our survival, it has been exactly that. Doctors have been fighting to get us to survive and to get to this point, but we're also an adult disease now. There are more adults than there are childhood patients, thank goodness, and thanks to a lot of their work. But now we're adults, and we need them to think about adult issues, right? And so I think it's really important that, the conversations that they're having with younger patients. I've also heard of a lot of FA patients, who talk to, their oncologist, hematologist, and in childhood were just told, yeah, you're going to be infertile. There's no way you're ever going to be able to have kids, without ever running any baseline tests, without knowing anything about their fertility history. Men particularly get told that, and there's actually a few kind of targeted therapies or even procedures that can be done to pull sperm, even post-transplant. And so those kind of blanket statements need to literally die. Like, I never want to hear a doctor that is not a reproductive endocrinologist and has not run a health history on a patient ever tell them that they're infertile.
I think that's all you need to say right there.
Like, it is not your level of expertise. It is not your body. And and it's not your hope, right? Like, who are you to dash somebody's idea of parenthood? And so there need to be a lot of conversations about, you know, those initial things. And then I would like just one researcher or just one physician to develop a curiosity in this, because fertility is not something that is necessary to my existence, but having a family and being a mother is something that will enrich my quality of life and that will drive my purpose. And so, like, I'm thankful that they're, you know, that they're doing research to have better targeted approaches towards different cancers, but I also want them to care about my quality of life, right? And so if just like one of them can develop that curiosity to say, okay, let's re-examine the data that we have and interview people really thoroughly so that we can have, so one of the biggest things for me going into this IVF cycle, the reason I'm drinking all these juices and doing all this woo-woo stuff is to better my egg quality. And I think that's a big factor from other women that I've talked to, they're experiencing the same thing. So maybe targeted research towards what tanks our egg quality. Is it just because we age faster than other people? Do we have like higher numbers of natural killer cells? Like what are those answers, so that, because once we understand what's at the root cause, and it's different from person to person, there are targeted approaches that we can go into. So I would just love, I want 99.9999% of you making sure that I live a long, healthy life. And then I want the like 0.0001 of you to make sure that I can do that with my kids.
I think you've gotten the message across really nicely and clearly. Thank you. And it is an important conversation, and things can't start to change until we have conversations. So hopefully that's what this will do. There's researchers and clinicians that will be seeing this and hopefully listening and taking heed and making a difference. So thank you so much.
And if that 0.001 is out there, I can point you to all the people that have all the data, and I will literally give you any part of my body that you need to start your research.
I don't think that'll be necessary. Just your email address will be fine, I think.
Okay.
Well, thank you so much for your time, for your willingness to share and be vulnerable. And I just wish you all the best, Mary-Beth.
Thanks, Suze.